The truth about cholesterol, what you think you know might be wrong. I remember when I was young that all of the focus was about consuming saturated fat and cholesterol and how to avoid it. Well, the last 20 years of research has really changed this thinking, and we're going to cover that in today's video. I'm a family physician. Let's talk about cholesterol. Let's first review some of the things that you probably already know about cholesterol. Cholesterol is a type of fat found in your blood. It can be harmful to you because it can build up in the walls of your arteries and cause heart disease. You should avoid foods high in saturated fat like fatty meats, butter, whole milk, and ice cream. You should also avoid eggs because they are loaded with cholesterol. All of these things will raise your cholesterol, which is bad for you. You should eat plenty of fruits, vegetables, and whole grains. And if you have diabetes, you need to watch your cholesterol even more closely because it puts you at even higher risk for cardiovascular disease. Now, where did this information come from? Most of it came from an organization called the American Heart Association. They have been very influential in telling us what foods we should eat and what foods we should avoid. In fact, their recommendations were so influential that many doctors used them as the basis for prescribing medications to people like statins. Statins are drugs that lower your cholesterol by decreasing the production of cholesterol inside your liver. Well, it turns out that much of the science behind the advice that the American Heart Association has given us over the years was seriously flawed. First of all, let's look at the evidence showing whether or not dietary cholesterol actually increases the cholesterol in your blood. One way to determine this is to look at what is called a meta-analysis. A meta-analysis is a study that combines the results of several other studies together to give you a more definitive answer. In 2018, a meta-analysis was published combining the results of 30 different studies looking at this exact question. The researchers concluded that eating dietary cholesterol does not increase the amount of cholesterol in your blood. They concluded that there is no longer any reason to restrict cholesterol in your diet. Now, if you followed my advice up until this point, you might be asking yourself, well, wait a minute, isn't cholesterol bad for me? Isn't it associated with heart attacks and strokes and things like that? Let's take a look at that. There is another meta-analysis, one that included 53 different studies and nearly 29,000 participants. Researchers concluded that eating a diet low in saturated fat and replacing that with either unsaturated fats or carbohydrates did not reduce the risk of having a heart attack or a stroke. Now keep in mind that this meta-analysis only looked at people who already had cardiovascular disease. So it didn't look at people who ate a low saturated fat diet to prevent a heart attack. We don't have good data on that. But what we do know is that in people who already have heart disease, lowering saturated fat in the diet doesn't seem to improve outcomes. And then comes the most recent study, published in 2021. This was a study that actually looked at people who did not have cardiovascular disease, who ate a low saturated fat diet compared to those who ate a diet higher in saturated fat. They wanted to see if those people who ate the low saturated fat diet were less likely to have a heart attack or a stroke than those who ate the normal saturated fat diet. It turns out that those who ate the higher saturated fat diet were actually less likely to have a negative outcome. Those people were 17% less likely to die of any cause during the course of the study, as well as being less likely to suffer a heart attack or a stroke. So you've heard me say this before, but I'll say it again. An ounce of prevention is worth a pound of cure. In other words, preventing a disease is a lot easier than treating a disease once you get it. And since we now know that eating a diet low in saturated fat does not help prevent heart disease, it would stand to reason that a diet higher in saturated fat wouldn't hurt you either. Well, in 2019, a group of researchers decided to tackle this exact question. They wanted to know if eating a diet higher in saturated fat increased your risk of dying prematurely of any cause. They identified almost 6,000 people who died from cardiovascular disease and compared their dietary habits to those who did not die during the course of the study. What they found was that those who consumed more saturated fat were actually less likely to die prematurely. It turns out that the more saturated fat you consume, the less likely you are to die soon of any cause. That's pretty powerful. What about the advice that says you should avoid foods high in cholesterol because they will increase your cholesterol and that's bad for you? Remember, we already reviewed the scientific evidence that shows this just isn't true. Eating dietary cholesterol does not increase your blood cholesterol, according to multiple meta-analyses. As far as the advice that you should eat plenty of fruits and vegetables and avoid red meat and butter and ice cream and eggs, I'm afraid that there is no scientific support for this whatsoever. In fact, I could show you many studies that show that eating red meat in particular is actually protective against all sorts of chronic diseases, including heart disease, cancer, and diabetes. I've already made videos on this topic, and I'll link them below if you want to learn more. But the bottom line is that the American Heart Association has been telling us to eat a diet that is unproven and possibly even harmful to our health. If we look at the American Heart Association's website right now, we still find these recommendations to limit our dietary cholesterol intake to less than 200 milligrams per day and to limit our saturated fat intake to less than 6% of calories per day. These recommendations are based on research that is now known to be flawed and possibly even fraudulent. For example, the Nurses' Health Study, which is often cited as evidence that saturated fat is harmful to you, was actually exposed as having major flaws in its study design. Multiple authors have written about this, and I'll link those articles below. The bottom line is that you cannot trust the science that the American Heart Association is using to make their recommendations. Okay, but DOC, what about all of those observational studies that show that people who eat lots of fruits and vegetables live longer and have less heart disease? That sounds pretty convincing. Well, as good as these studies may be, they're still only observational. This means that you cannot prove causation from these studies. You can only look at associations. For example, maybe it's not the fruits and vegetables that are beneficial, but rather the lack of processed foods in the diets of those people who eat lots of fruits and vegetables. It could also be that people who eat lots of fruits and vegetables tend to be more physically active than people who don't. Or maybe it's psychological. Maybe people who eat lots of fruits and vegetables are generally happier people who have better health outcomes just because they're happier. We simply cannot know from observational studies. There's another problem with observational studies, and that's called reverse causation. Just because you observe two things happening together doesn't necessarily mean that one causes the other. It could be the other way around. For example, we observe that people who have high cholesterol tend to have heart attacks. Does that mean that high cholesterol causes heart attacks? No. It could also mean that people who have heart attacks tend to have high cholesterol afterwards. When we look at randomized controlled trials, which are considered the gold standard of medical research, the evidence clearly shows that eating a diet higher in saturated fat is not harmful to your health, and it may actually be beneficial. So where does all of this leave us? If you follow the advice of the American Heart Association, you have probably greatly restricted your diet, avoiding things like butter and meat and eggs and ice cream. And instead, you've probably replaced those foods with breads, cereals, and fruit juices. And now we know that this may have been harmful to your health. What should you do now? You should slowly begin to reintroduce foods that were demonized by the American Heart Association back into your diet. Enjoy meals that include meat and butter and cheese and eggs and ice cream and desserts. If you are pre-diabetic or diabetic, you should proceed even more cautiously. Begin by adding healthy fats like omega-3 fatty acids back into your diet. Cook with butter or coconut oil. Slowly begin to add back in meat and eggs and cheese. And when you do this, you should carefully monitor your blood sugars and your A1C. I recommend using a continuous glucose monitor like the Dexcom or Freestyle Libre. This way you can add back in foods that you enjoy without fear. And you can learn to recognize which foods cause your blood sugar to spike and which foods don't. I'm confident that you will find that you can eat many of the foods that were previously off limits to you without harming your health. In fact, you may find that doing so actually improves your health. If you want to learn more about the benefits of eating meat, butter, and eggs, check out the playlist of videos on this topic by clicking here.